Hello and welcome to Saul Ewing, Arnstein & Lair's webinar on coronavirus, COVID-19 Prevention and Preparedness for Employers. This program is hosted by the firm's Labor and Employment Practice. My name is Rob Dustin, and with me today is Lisa Coughlin. We will be your presenters for today's webinar. A few housekeeping notes before we get started. We're going to use the messaging feature to handle Q&A. To submit a question, simply type in your question in the Q&A box on your screen and hit submit. Only the presenters and webinar administrators will be able to see your question. If you need technical support, you may enter that in the Q&A box as well. Please feel free to pose any question at any time, and we'll do our best to answer it during the program or at the end, or as follow-ups, and I'll tell you about that in a minute. We do capture all questions. We'll reach out after the webinar and event. We don't get a chance to respond during the program. You can expand your slide area by clicking on the maximize icon on the top right of the slide area or by dragging the bottom right corner of the slide area. Regarding continuing legal education credit, we're providing 1 hour of New Jersey, New York, Pennsylvania, Minneapolis, Illinois, Florida, Delaware, and Virginia credit today. Please keep in mind that New York recognizes New Jersey as an approved jurisdiction and will honor those credits. We'll also be providing 1 hour of SHRM credit to those who are interested. Since this program is considered distant learning course, you'll need to pay close attention for the random numerical code slide that will appear within the PowerPoint at 2 separate points during the presentation. The survey, which will be sent out within 3 business days of this webinar, includes a location to report back those codes and additional information necessary for processing credit. Once we receive your completed survey, you'll be emailed a certificate of attendance. You may also request a copy of the slides at that time. And now, let us begin. Let me note right up front here that my colleague Lisa and I are sitting at least 6 feet apart right now, as is everybody else for social distancing. Lisa has put in an incredible amount of time first on the alert and researching and staying on top of and preparing most of this presentation. But she gave me permission to disclose this. She woke up this morning because there are seasonal allergies. And those seasonal allergies, how do we know that? Because she has congestion, which according to a news report in the Post today discussing allergies versus COVID-19, only 4% of all Chinese cases had nasal congestion as a symptom. And we know that she has regular allergies and has no other risk factors. So Lisa, though, because of that, her voice is a little scratchy. She's going to be helping out and talking some, but not as much as we had hoped. You'll see the legal disclaimer. It's just the usual. Follow that. Saul Ewing has put together an attorney task force. You'll see the different kinds of areas that we are covering on this task force. There are just going to be a whole lot of legal risks, and we're only touching on a combination of them today, and I know that most of you are thinking about this. First, there are the legal risks of not acting sufficiently, possible duty and breach, and we'll be talking about some of those in the workplace and OSHA issues, and whether with plenty of notice, if you don't develop plans of action, what are the effects or not of not canceling trips abroad, depending on the information, or following other practices. There are some legal risks to taking action, and there are going to be issues involving landlord, tenant, and lease issues, exposing your clients or the public to potential exposure by somebody who's positive, targeting employees from certain countries, or engaging in discrimination, and a wide range of other legal considerations, some of which we'll touch on, like the breach of contract and force majeure issues that many of you are looking at to get out of contracts you may have in the U.S. or with vendors abroad. It's a lot of different legal areas. We'll be focused today on the employment ones. So here is the outline of the roadmap of what we're going to do today. We're going to talk some about the current status, public health agency guidance, going through checklists on disease preparedness and management planning, responding to various scenarios, and then time for questions. There are still a lot of unknowns regarding the epidemiology of this virus. As testing expands in the U.S., the advice from public health officials may and probably will change. Public health in the U.S. is primarily a state or local responsibility, and we're going to say repeatedly that you should be checking with your local public health authorities for guidance in your particular area, and that will be important as things continue. Saul Ewing is going to continually monitor and update our advice to our clients. We'll be including some additional information and thank you notes after this webinar. There'll probably be questions we can't get to, and we'll do those in an FAQs in the next few days. Many of our questions we're getting from our clients are not black and white legal questions, can I legally do this or not, but questions about risk assessment and employee relations, what should I do? Absent direction from your local health authorities, these are business judgment and the details make a difference. WHO, CDC, and all public experts say to prepare for more serious effects, but not to panic. And the metaphor I'm using right now is not just buckle up for a rough ride. It's prepare like you're going on a major trip. In my case, I use the metaphor of going out on the Appalachian Trail or the PCT. You got to prepare and prepare a lot and prepare for the unexpected. You need to have your supplies. You need to have your plans in place. You need to talk about to your experts. And things are going to change, so you need to be aware of the changing conditions that are going to happen and be resilient and then adapt as you go. So with that, let's go to our first hypothetical. Hypotheticals are sometimes derived from questions we're already getting and others from the ones that we think are going to be the most common. These are not any specific companies. Megacorp just announced that until further notice, employees are not to engage in personal or business international travel or any cruises except for certain limited pre-authorized work trips. Many employees are complaining about canceled plans and losses. The next day, your employee Bob comes into work wearing a face mask and passes them out. So questions. Can Megacorp enforce this new policy? Would it make any difference if this were a healthcare company? Is Megacorp obligated to reimburse employees? Does Megacorp have to allow Bob and his friends to wear face masks at work? When you do this in the future and use these slides around your groups, have a group conversation of these, test people. Here are our answers right now. Megacorp can enforce this new policy. Megacorp can make any rules it wishes for employees that are not illegal, and as long as they're applied equally in a non-discriminatory manner, even if they may appear unreasonable to employees, it can enforce them, and the enforcement is through discipline or discharge of at-will employees. Obviously, if there are contract provisions or other agreements or a union involved, you'll need to look at those as well. And there is no law that says employers have to reimburse employees for these personal losses. Some of you may choose to do so as an employee relations issue. If this was a healthcare company, there's even a stronger business justification to prevent the loss of critical employees to quarantines after travel and to prevent exposures to their employees. As far as the face mask issue, this is coming up a lot. No, you do not have to let employees wear face masks in the workplace. Employers can follow CDC guidelines, which do not recommend face masks for anyone who is healthy. As a matter of fact, employers should not encourage healthy employees to wear face masks because they're in short supply and needed by healthcare providers. You're hearing a lot about face mask shortages, and you have a role in making certain they're not used unnecessarily. There are workplaces where they will be more important. So now I'm going to turn things over to my colleague to start with some of the other background on COVID-19.
Thanks, Rob. So as pretty much everybody is aware, COVID-19 is a respiratory illness, and the primary symptoms are fever, cough, and shortness of breath. Now, the unique thing about COVID-19 is that it's a new type of virus for which there is no immunity or cure at this time, which is why we're facing the outbreaks that you're hearing about today. As you may be aware, the situation is evolving very quickly, and there's still a lot that we don't know. So it's really critical to continue to check in with the CDC and your local public health agency to find out the latest updates. The other important factor to remember in this case is that not every healthcare provider has test kits right now, or they only have a few. So for employees or individuals who are concerned that they may be infected, they may be making a good faith effort to get tested, but it may take longer than usual to get those results. We also wanted to provide some updated statistics to everyone, and of course, in the true fashion of this emerging circumstance, these statistics actually need to be updated even from last night. So currently, there's about 115 known cases of confirmed COVID-19 globally. There's about 4,000 deaths worldwide, including 1,000 cases in the U.S. and 27 fatalities that we're aware of. There's a number of states that have they've declared state of emergency. Primarily, that is so that they can get appropriate resources to healthcare facilities. COVID-19 has been detected in at least 36 states at this time, It's being spread through the community, person-to-person contact, or possibly even through touching infected surfaces. You're going to hear us today throughout this presentation talk about something called community spread. And what that means is that there are circumstances where people have been infected in a certain area, but we're not sure how or where they became infected. And that can lead to certain outbreaks. As most of us know, most individuals develop very mild symptoms of this virus within 2 to 14 days. However, there are some vulnerable populations to be aware of. Those who are over 60, individuals with underlying conditions like heart disease, lung disease, and diabetes, and it's important to keep those individuals in mind when formulating your policies in the workplace.
So, of course, you need to be able to distinguish between COVID-19 and other illnesses, and it is unfortunate that it's still flu and cold season. That's going to make things complicated here for the next several months. But even within that, flu is something you can test for, and you're making risk assessments every day on employees, and you will need to track these going forward, even after flu season is over, to watch the distinctions. One of the things that we will be watching out for is outbreaks. An outbreak is a WHO declared or a CDC declared situation in which there is beyond the normal expectancy in a particular time and place. And once an outbreak is identified and declared, then you have local public health authorities, or in some cases national public health authorities, who will advise on what should be done in outbreak areas versus others. At this point, the major outbreaks have been declared in high-risk other countries, and we are not at the points of an epidemic or pandemic being declared yet. And the CDC says the risk to the general public from outbreaks all depends on the characteristics of the virus, how well it spreads, severity, medical and other measures to control it, whether there's vaccines. That's the general rule. Obviously, here with COVID, there is no vaccine, and we don't know yet the degree of spread, the percentage of the illnesses. We're operating based largely on information from how the disease has progressed in China and in other countries. Not enough testing here in the U.S. yet to determine all of that. So again, you turn to what the public officials advise.
So based, again, on CDC's current risk assessment, most individuals in the U.S. are still at a low risk of exposure. There is increased exposure in places where there is community spread, for healthcare workers, certain sanitation workers, of course those who have been in contact with individuals who have confirmed COVID, as well as individuals traveling to those high-risk areas abroad, which we will get to. As stated before, it's really critical to continue to pay attention to your local health agency. For example, Pennsylvania and New Jersey have issued their own state advisories about travel and self-quarantine and other similar measures, and that information from local public health agencies is being updated regularly, and it is at this point still somewhat location specific, so please keep those in mind.
So going back to the issue of vulnerable populations, as somebody who, my wife and I are turning 60 this year, and she's got some underlying issues and conditions, we are at the cusp of vulnerable population, but it's also at this point, as far as we can tell, geometric. The older the worker is, the older the individual is, the higher the risk. That seems to be the case. But obviously the advice on this is changing almost daily. Just in the last week, CDC officials last week were recommending that individuals over 60, as well as those with some illnesses that make them more vulnerable, consider limiting their exposure to certain types of events. They even expressly mentioned church and synagogue and other locations that might be inside with low ventilation and crowds, as well as the statements earlier last week about avoiding cruise ships. Why are we getting these broad statements from public officials right now? Two big concepts. One of them is social distancing and isolation, keeping people who might be vulnerable away from locations where they might be exposed. The others is the broad question of trying to contain community spread. You're getting broad advice from public health officials and sometimes from local officials on closures. because the more self-isolation there is early on, perhaps the greater the chances of containing the virus. So these updates and the risks for vulnerable populations will continue to evolve, but as you do your planning, one of the things you have to consider is whether or not the decisions you're making are being done to protect all employees, or are you targeting those who are at most risk, or just trying to aid in containment by taking certain actions sooner rather than later.
Okay, so for those who are doing CLE credit, this is your first code. Please take a moment to record this code so that you can get credit for this course. We're just going to leave it up here for a few moments for those participating. Okay.
So let's go to our second hypothetical. Julie is a 19-year-old cashier at a grocery chain. She's not eligible for benefits or leave. Her neighborhood has had several confirmed COVID-19 cases. She calls her supervisor to say she's not feeling well, has an upset stomach. The supervisor is very frustrated and asks whether Julie has a fever. She says she has a low fever, and the supervisor tells Julie she better be back to work soon or she'll be out of a job. Julie comes into work the next day feeling worse. So the questions: could Julie's symptoms be COVID-19, and was it legal for her supervisor to ask about Julie's symptoms? The answer is yes, Julie's symptoms could be COVID-19. Now, there's only a small chance that stomach virus or stomach symptoms are going to be the first, but there are some reported cases and documented cases elsewhere that the first presentation was stomach. But the bigger issue is the fever. And a low-grade fever wouldn't itself necessarily indicate COVID-19 versus any other kind of illness. But fever is the bigger issue. And yes, it is permissible for the supervisor to ask Julie about those symptoms. Under EEOC guidance, the best guidance we have right now is from 2009 EEOC guidance you may have seen or heard about already that dealt with pandemics, and this was launched after the H1N1 virus. And under that guidance, questions about flu or cold type symptoms are permissible, and they're not considered disability-related inquiries at that time. You do need to ensure that the employer that everyone reporting symptoms are asked similar questions. Again, non-discrimination is a big issue here, and you want to make certain that all of your employees who are reporting illnesses are treated the same.
Okay, so here's the general prevention guidance for individuals as well as businesses. I'm fairly certain that most people listening have seen this all across the internet on our alert in different locations. We put it up here so that you have it as a resource. If you have not already included this information in your notices to your employees or posted on the entrance to your office, we recommend that you do so. It's really important that everyone is aware of what their obligations are and how to best prevent potential exposure. And as I'm sure you guys know, employers have a general duty of care to institute these kinds of measures in the workplace. Ultimately, at this point, we're getting a lot of questions about, what else can I do? It's important to be reasonable and use common sense. And as an interesting example of what not to do, I read that Tito's Vodka issued a PSA that the alcohol in their vodka should not be used for hand sanitizer, everyone. So in case you were thinking about making your homegrown hand sanitizer, stick with the official Purell and the other brands. So use common sense. Along with those lines, it is appropriate at this time to actively encourage sick employees to stay home. You can do this through the posters. You can do this through, meetings and discussions. And equally important is that you're being flexible with your sick leave policies. So a lot of states now require sick leave, whether it's part of PTO or an independent policy, or if you're in a state that doesn't require it, where in some situations you might only let people, use sick time if they're sick. You may want to consider vacation, personal time, whatever time individuals have available. And you should also be aware that employees may need to take time to be with sick family members due to the nature of this outbreak.
So let's pause here and talk about when you should let people come back to work. If you're sending people out to be cautious with any kind of respiratory illness right now, when do you know whether they're well? Well, the basic rule is first you should be free of symptoms and free of fever for at least 24 hours. The CDC has very specific guidance for individuals who have been found positive for COVID-19 and are either at home isolation or in the hospital. And they are first saying, most importantly, this is a case-by-case judgment. This should be a medical judgment that is decided by the individual's doctors or public health officials, and that should be the first thing you look for. What they say ideally will happen is not only that someone is symptom-free, but that there are 2 negative tests for COVID-19 that are taken 24 hours apart. Obviously, in the next few weeks or months, it may be very difficult for individuals who send home sick with respiratory illnesses to get 2 negative test results. Instead, you're going to be relying on people who go to their doctors and give them a release to return to work based upon the nature of their illness. Maybe they tested positive for flu, maybe the other symptoms are gone, but that it's going to be the doctor's judgment in the first case. And yes, you could require that return to work release. Whether you do and insist that they go to a doctor first or base it on other reports of being symptom-free, those are the individual judgments that you're going to have to make as a business.
Okay, so continuing with our pre-exposure guidance, as discussed, if you have an employee who comes to work who either self-discloses or appears to have these symptoms of a respiratory illness as guided by the CDC, you should ask the employee to go home and separate them from the other staff. And of course, along the lines we've been discussing, make sure to continue to perform routine cleaning and even step up your cleaning measures that may have already been in place. So one question that may come up is, what about employees who are going to be traveling and you're aware that they're going to be traveling? So the important factors here are to make sure that your employees are informed about CDC travelers' health notices. We know there's a lot going on in Italy, Iran, obviously China, and other locations, and the CDC is continuing to update its list of high-exposure destinations. Equally critical is that employees should be aware that they're required, if they become sick while traveling, whether it's work-related or personal, they should be notifying a supervisor before they come back to work, and they should be calling their healthcare provider. And the guidance is to call ahead before going in and let the doctor tell you whether an in-person visit is necessary.
So let's pause here and talk about travelers coming back. First question, that we get asked a lot, can I ask employees who are traveling to tell us where they've been? The answer is yes. Just as you could prohibit them from going if you wanted to, you can require them to report where they're going and then follow CDC rules. Somebody just comes back from spring break from Italy, CDC recommends a 14-day self-containment, and you can enforce that on the way back. You can monitor those issues. For other places in other parts of the country that have not been identified as high-risk areas, you can at least assess that risk with their doctor and based upon what local public health authorities are saying and make the judgment that it might be a high-risk area. That's not as obvious as when somebody is sick, but these are decisions that you can, in fact, make to be overly cautious if you choose to. But again, this list of individuals in hotspot areas is going to evolve, and often, sometimes public health officials will have said something. So let's move on to our next hypothetical. This will be one of several restaurant ones we might get to today. Michelle is an experienced server at a regional restaurant. She notices that a customer at her newest table has been coughing and has a runny nose. Michelle tells her floor manager she doesn't want to serve the customer due to fear of COVID-19 exposure. Michelle says that if her table is not reassigned, she's going home. So here are the questions. Does the restaurant have to comply with Michelle's request to switch tables? Does the restaurant have to ask the customer to leave? Can they ask the customer to leave? And is Michelle allowed to leave her shift early over what may or may not be legitimate concerns about COVID-19 by a customer? And the first answer is, do they have to comply with Michelle's request? Probably not. A risk assessment would likely determine that this customer has the cold or flu, and the customer should be treated just like any other customer with these symptoms. Now let's pause there a second. If I've got somebody who's coughing and sneezing and says that they're running a fever, well, and can I ask them if they have running a fever? Sure you can. Can I ask a customer legally to leave if they are visibly sick and I'm worried about other customers? Yes, that's not discrimination on any basis in public accommodations. It's based upon likely contagion of a disease. Does it matter whether it's COVID-19 or actually is the flu? Not as far as what you can do, but if your assessment is that this is a low risk, you can treat the customer the same as anybody else, and you tell Michelle she should continue serving the table she was assigned, except that you may want to provide other protective measures. You may want to tell servers if they have somebody who's sick, if you choose not to have that customer go home, that they can use other issues. And then what do you do if Michelle is in a high-risk population due to her age, health condition, or something else? That may be another basis to say Michelle shouldn't serve sick customers and to reassign somebody who might be at lower risk. So you can determine whether you're going to be screening all customers for COVID-19, and some people are talking about doing that, recent travel or symptoms or other contacts. But whatever you do, you need to be thinking ahead about what you're going to do with your customers who are sick, what you're going to do with your employees who develop symptoms in the workplace at a time when you won't know whether or not it's COVID-19 or just other symptoms.
Okay, so thinking about preparing for workplace meetings or events, here's some general guidelines that you should hopefully already be following, and if not, make sure you're implementing as soon as possible. A good example, I think, as Rob said today, we're here in a room, there's about 5 people in this room, and we are all sitting at least several feet apart just for extra precaution. You can never be too safe. You also want to make sure that when you have meetings that you're retaining the contact information of the participants and visitors. It's really helpful to public health agencies who are investigating any possible exposure when they have the list of people who've been in contact with someone who may have COVID-19. When you're maintaining that information, if you do suspect that an individual in your workplace has been exposed, you can let the employees who were in contact with that individual know so that they can monitor symptoms appropriately, but you should not disclose the name or anything about the identity of that individual. It's important that you maintain confidentiality. You also want to be sure to think about if you're able to designate a certain area where individuals can go for isolation if you think that they might be exposed or they might be ill in the event that they can't immediately go home. And equally important is thinking about working with your public health agency, your building management services to think about exit strategies in the event that there is exposure in your building.
Let me interject a second, Lisa, and note something that we may not have mentioned before, which is the distinction between what the law requires and best practices on prevention and best practices on action. You'll notice that we are citing at our slides, and nearly all the stuff in the checklist are all coming from WHO, CDC, or other official sources that are making recommendations across the board for best practices for safety and prevention. Not because the law requires that, because that's the medical best advice right now. The legal aspect is whether or not failure to do so is going to violate the general duty clause or in some ways subject you to negligence or other claims. So when it's a legal issue, we're going to call that out. But a lot of this it's not just common sense, it's expert health recommendations.
Exactly right. I'm going to go through this fairly quickly. More information about preparing for large meetings. You all will have access to the PowerPoint information after the presentation is over. I see there's a lot of questions about that. We will make sure you have copies of these slides. I do want to just comment here that depending on possibly location, level of exposure, and certain specific concerns, some businesses are considering issuing limited questionnaires which ask individuals coming to their facilities about recent travel to high exposure areas, recent contact with anyone who has COVID-19, or if they're experiencing the cough, shortness of breath, or fever that the CDC is concerned about. If individuals respond yes to any of those questions and you're in a position where you are issuing those questionnaires, you can ask the individuals to participate remotely. Just be sure that if you are doing this, you do it for every single participant and don't single anyone out.
Now, these various checklists that we have in here, we've also put into a Word document that's going to be sent with the thank you note. That is a document that we will be revising and updating periodically on the firm's website under its task force resources as a checklist that will be available to employers on things to consider and put in their disaster preparedness plans. Obviously, there are some things that every firm is considering right now or working on or should be, which is what happens if things get worse as part of the preparation, lines of communication, reporting structures, who's essential, non-essential, do you have the capacity to work from home? If so, how are you going to do that effectively? How do you run your business? What do you do when your business starts falling down? All of those issues, including all the discussions of business travel and whether or not to cancel trips, they're all things that a lot of people are considering right now. We have to be prepared for possible increased numbers of employee absence due to illnesses, both from the employees and don't forget their family members. As students are asked to leave school because they're sick or other family members get sick, caregiver responsibilities are going to increase. Those absences may increase. You need to think about cross-training of your personnel on essential functions in your businesses. You may want to consider decentralizing some decision-making to your local managers that otherwise might be done by centralized HR as a best practice. And we can say coordinate with public health officials. They are going to be overwhelmed with inquiries, so following guidance and best practices that are already out and then call on specific questions.
So in keeping with this theme of disease preparedness plans, we wanted to make sure that you had more information about how to actually structure these plans and what the content should look like. Of course, they are going to be somewhat industry specific, and you have to consider your particular location, the size of your workforce, et cetera. All of this will be provided to you in that Word document, but it's really critical to think about what the phases of your plan look like and who is responsible for each phase. So, for example, if you find out that an employee's spouse, they just found out their spouse has COVID-19, but they came to work before they found out, what is your plan of action? That's the type of conversation you should be having. Other items to consider are, do you have appropriate IT support to maintain your systems if you need to work remotely? What vendors and clients, need to be rerouted or postponed in terms of services and meetings? How's your mail going to get delivered in the event of a closure? Who's going to receive the notifications from any public health agencies that you work with? Can you identify any alternative work sites in the event of an exposure? Who's your spokesperson for the media? We know that the media is very involved. They're asking a lot of questions. You're going to be getting a lot of calls in the event that you have an exposure. Who's your go-to person? And do your employees know that they are not the media spokesperson, right? That they're not to be speaking on behalf of the company about these issues. These are the types of questions that you should be considering. And again, this information will be provided after the PowerPoint.
Now, some of this sounds familiar. It should be. Most larger organizations have emergency preparedness, critical event plans and task forces, and they have pre-identified on the theory that you can never know what the next crisis is going to be that's going to lead to business interruption or delay or a problem or something where you need to respond as an organization quickly and notify your employees. Colleges and universities are doing this in all types of areas. Most businesses are. And this is just taking that plan and applying it to a different set of scenarios where you're simultaneously having to view the impact on your business and everything that's going on in the community at the same time.
Okay, I don't think we're going to spend too much time on this because we want to definitely get to more hypotheticals, which will, I think, touch on a lot of the questions that we're getting. I just want to remind everyone of a few other items, such as putting your insurance carrier on notice in the event that you do have potential exposure, and even think about things such as onboarding. You know, I'm sure that everyone is concerned not only about their current employees, but possibly incoming employees, and think and plan about doing that remotely as well. And again, I want to remind everyone that if you do have exposure or even possible exposure, make sure you maintain confidentiality about who's actually involved in that situation. Okay.
So we labeled this slide, we're at the one before. So obviously there's some other what to do during an outbreak. And whether or not you call this as things to do during an outbreak, or even when you have the first possible case or the first diagnosed case, it's really the same approach. It's the same team approach to decision making. It's looking at what your protocols already are on your emergency response plan, talking to the experts. What do we do now that we have our first positive case, either with one of our employees or a family member of an employee, and how are we going to do that and moving forward, and then implement that plan. So some of these could be done in ahead of time. Others are being done, and this is WHO and CDC for outbreaks. You can start thinking about all of this much earlier with early diagnosed cases. Once we know for certain that somebody or a family member has been diagnosed as COVID-19, obviously there needs to be actions taken to inform those who came in contact with them. Isolate the employee if they've been exposed, have self-quarantine for those individuals, inform others who've been exposed, and then figure out what are you going to do with those possible exposures. And what are you going to do with the business and with each of those individuals who might have been affected, which is going to vary by business, location, and whatever your public health officials and their doctors are advising them. But you do need to have to plan what somebody to do too when somebody gets sick at work and you suspect it may be, or somebody who shows up sick at work, isolating them, sending them home, and yes, you can send people home when they are sick, whether they want to go or not, legally. Those should all be part of your plan. And then you have to consider whether you're going to identify at-risk employees, those who might be more vulnerable. There is a right way and a wrong way to do this. The right way is to consider surveying employees on whether or not they are in any number of high-risk categories, which could include recent travel and medical conditions and other things. The EEOC has some specific guidance about this in that 2009 guidance report that says if I'm going to survey, don't survey people to say how old are you over 60 and what age, and oh, by the way, do you have any underlying medical conditions, please identify them here. What you want to know is whether they're in high-risk categories that they or family members or somebody else in their family may be at high risk. And there are some sample questionnaires in the EEOC guidance on that issue.
So I think Rob just covered the post-exposure guidance. So we're going to briefly touch on PPE, or personal protective equipment. OSHA actually did the other day issue guidance on COVID-19. Most of it is geared to what they're considering high or extra high risk level employees, which is primarily healthcare workers. So if you are a healthcare provider, clinician, you work in a hospital, definitely consult with that guidance, which you should partner with the CDC guidance as well, where they have issued specific healthcare related information. Otherwise, some basic measures that anybody can take is to make sure that all cleaning staff are wearing disposable gloves and gowns to protect themselves if they have not done so already, and also making sure that your cleaning staff report any potential issues with their protective equipment if they think that they may have been exposed to the virus.
Now, earlier we mentioned the OSHA General Duty Clause. This may be the first time for most white-collar employers that you've thought about the General Duty Clause in a long period of time. We've included it here, the general duty to be free of hazards that you were exposed to and recognized hazards. One of the things that was specific in the new OSHA guidance, and this is going to evolve too in reaction to it, is that you need to keep track of those who have been exposed to COVID-19 in the workplace. That begs the question about how I figure out who early on is COVID-19 versus some other illness, and how I log that, and how I figure out if the exposure was in the workplace or not. Those are issues we'll figure out down the road, but just know that for all workplaces, COVID-19 documentation of workplace exposures so that can be checked later is part of that new OSHA guidance. So Lisa, let's move on to the CLE Code.
Sure. This is the second CLE Code of the presentation. If you're looking for CLE credits, please make sure to jot this down. Okay, move right along to Kim's case.
All right, going to our next hypothetical here. Kim returned from visiting her family in South Korea just as the outbreak began and before any quarantine. She works as a sales consultant at a local clothing store. Customers have started saying they don't want Kim to pull merchandise for them and walked out. After a few weeks, the manager told Kim there's nothing he can do, had to lay her off until some of the fear dies down. Does Kim have a claim of discrimination? All right, this is one of the few real easy ones. The answer is yes. This is just a new version of an old problem of customer discrimination against employees. Customer discrimination is not a basis for adverse action, even if customers refuse to deal with somebody because of race, gender, national origin, or anything else. Here, it's a form probably of national origin discrimination in violation of Title VII of state laws, and on that basis, you should not lay her off and should not take any adverse action. You've got a liability issue.
Okay, so there's a number of legal HR matters to consider here. I think, as a lot of you I'm sure are aware, we have the ADA and FMLA, which relate to serious health conditions or disabilities as far as time off and accommodations. There's wage and hour, and possibly even labor. With respect to the ADA, it's important in this case, and this is what the EEOC guidance has said, to determine whether or not there's a direct threat in the workplace that could create a substantial harm to the health or safety of an individual in the workplace, whether it's the individual or someone else that they work with. And according to the EEOC and the CDC, this sort of depends on the severity of the illness and the situation at hand. At this stage, as Rob mentioned earlier, you are allowed to ask employees about symptoms related to flu or the common cold. These are not disabilities under the law. This is very different from asking a broad question such as, do you have any chronic illness, or even asking if they've been hospitalized, or maybe other types of questions. If you keep it to the specific symptoms that the CDC has warned about that relate to common cold and seasonal flu, then you're not running afoul of the law. So it's really critical to keep that information in mind. As far as the FMLA, if you are an employer with more than 50 employees in a 75-mile radius, it is possible that an individual who has COVID-19 would qualify for FMLA, depending on the situation. It's going to be a little bit of a case-by-case analysis, again, because things like common cold and flu would not qualify, but if you have, if there's other elements of prolonged treatment involved, doctor's visits, all of that, then certainly we fall in the area where FMLA may need to be awarded. So it's really critical to still send those forms to your employees and get the information from their medical provider, just as you would in other situations.
Okay. So now we're going to turn to a couple more hypotheticals. Given the number of questions that we have, we are probably not going to get to more than a couple now. I've included other hypotheticals and answers that you can review later. If we really run through all the questions, we may have time. In addition, we are going to stay on a little bit after 1 o'clock to try to get in a couple more questions. Those who have to leave precisely at 1, we will let you know, and we'll stay on a little bit longer, trying to get some, and any questions we don't get to, we'll answer the next couple of days. So very common situation. A lot of these questions are illustrated in our restaurant worker. Samuel, who works in a restaurant franchise, just came back from a trip to New York City. He calls his manager to say he has a cold. Manager told him to stay out for 2 weeks unless he gets a doctor's note that he doesn't have COVID-19. Is the manager assuming that Samuel has a disability under the ADA? Can the manager do this legally? Does Samuel have a right to be paid? And does Samuel have any FMLA rights? The answers under EEOC guidance, the manager, under the EEOC guidance, the manager is assuming that Samuel might have COVID-19, not just a cold. But that virus will typically be of short duration for most people, and under the guidance right now, it would not be a disability. So it doesn't raise an ADA issue. It raises an issue of a medical condition that would be of very short-term duration. Manager does have the right to require that all sick employees stay home until he is symptom-free, even if it's just a cold or flu. Samuel has no right to be paid unless he has accrued paid leave or rights under some other company policy or contract. And if he's a covered employee under federal law, he may have unpaid leave rights under the FMLA. So again, in answer to that very common question, do I have to pay my employees when I send them home because they're sick? The answer in most cases for most at-will employees will be no. Whether that changes as a result of legislation that's being talked about at the state and local level or anything else, that could change in the future, but for most at-will employees, this is a no, you don't have to. It's an employee relations decision. Another common question that we've been getting prior to this is in the next example, the road warrior. Sales force at Acme Manufacturing is on the road all the time, driving or flying to meet customers, manning tables at trade shows. They work on commission. John works in a territory that includes Washington State. He asks his boss if he can start handling his customers by telephone or Skype, and his boss says no. Can John refuse to travel to high-risk areas? And does it make any difference if John is in a high-risk category or a family member is? Does it make a difference if John's territory is not high-risk now, but he's just concerned? And if John contracts COVID-19, does he have a workers' comp claim against Acme? Well, the simple legal answer is if John refuses, he's risking losing his job unless he has other contract rights. You can require business travel and other rules. If employees violate them, they can be subject to discipline, discharge if they're at will. Even if a family member is high risk, it doesn't make a difference. Right now, no public health agency has prevented employers from continuing to require business travel. He may or may not have a workers' comp claim under state law. He'd have to prove that he contracted the virus while on business travel. So, Lisa, at this point, before any other hypotheticals, I'm sure we have got some questions.
Yes, I've been trying to keep track of them. So a question that recently came in is, if a full-time exempt employee is working remotely or part-time, are you still required to pay them?
The answer is usually yes. Your full-time exempt salaried employees, if you permit them to work remotely and they are working, it's the old suffer or permit rule under the FLSA. If you tell your salaried employees to go home but not work at all and they violate that, you don't have to pay them. But if you are encouraging or doing telework and they are working even partial work weeks, absent some narrow exceptions about complete business closures, if you're allowing them to do that, they have to be paid for the work week.
Another question that came in is, what about employees who've traveled to high-risk areas? How long are you allowed to require them to stay home? Under current CDC guidance, if you have traveled to China, South Korea, Italy, or Iran, regardless of whether or not you have symptoms, you should be staying home for 14 days and monitoring your symptoms. That is the current CDC guidance, and you can follow that guidance as long as you're applying it equally to all employees who have traveled to those locations.
And obviously, if you're traveling from other areas that have, in the United States, there is no strict guidance yet about what to do with New Rochelle or Seattle or those areas that have higher rates but haven't been declared high-risk outbreak areas yet.
All right. Another question that came in is, what's the appropriate way to ask employees if they have possible exposure?
You should start by just asking if somebody is, well, it depends on whether you're asking, could they have been coming back from a trip versus somebody who's presenting illnesses or says they're feeling sick. So if you're dealing with the travel rules and where you've been, that's where you need to be monitoring where people have been, where they're traveling, and if they're coming from areas that with higher risks, you can ask, do you know whether you encountered anybody who was COVID-19? Are you having any symptoms yet? When you're dealing with somebody who self-reports an illness or somebody says, so-and-so is sniffling and sneezing and everything else, what can you say? Well, you start by going in and saying, I got a report you're sick, how are you feeling? And then you can ask those follow-up questions. What symptoms are you having? Are you running a fever? Is there some other medical reason? That's a yes or no question for these symptoms, which might elicit, yeah, I have seasonal allergies. Have you seen your doctor? And then you have to make the judgment call based on that. Are you going to remove them from the workplace and send them to their doctor or not?
And it's really critical. We do want to highlight that regardless of your policies, if your state has a mandatory paid sick leave law, perhaps you're a new employer, perhaps you're updating your policies, you must follow that law. So there are a number of states that require a certain amount of paid sick time per year. If an employee needs to stay home because they're sick, whether it's COVID-19 or not, and they have available sick time, you need to let them use it.
We know that the administration announced in the press conference a couple of days ago that they might be looking at legislation on that. There's been no follow-up on that yet. There were a couple discussions yesterday. We'll be monitoring what developments come out of Washington.
You want to keep going with some questions? Okay, great. We have plenty. Thank you all for writing in. I think, Rob, we should reiterate, we've gotten a number of questions about prohibiting personal travel, which I know we touched on at the beginning, but if you can reiterate that, it would be helpful.
Let me reiterate, while it sounds draconian, if I want to prohibit personal travel to protect my workforce and my customers and say my employees cannot engage in personal travel or personal travel to certain places, or you are not going to go on cruise ships, you have a right to do that, and you don't have to reimburse them, and they may or may not be able to recover that depending on the terms of their individual contracts. That's your legal right as an at-will employee, as an at-will employer. That's your legal right, and if they don't like that, they can leave. Whether you want to do that or not and how you want to approach that as an employee relations issue is a business judgment. But one of the subsidiary parts of being an at-will employee or being able to fire somebody for any reason is be able to set rules that your employees may disagree with or not like.
And along with that, there could be a question about enforcing that rule, right, which is also, somewhat of a gray area. It might be difficult to enforce, but we actually got a question about, what if you notice travel on social media? I think that if you are concerned that an employee is either abusing or misusing a policy or not following your policy, you should investigate that and make a determination based on the credibility of the information before you, just as you would if you're suspecting that they're misusing sick time or some other issue.
Right.
We've had a couple questions about situations where there are employees who are not able to work remotely because their job duty doesn't allow for it. Can they stagger shifts? What are some tools that they can use for employees who have to physically be in the workplace?
This is going to be a real company-by-company decision. How can I reduce risk, or how can I respond if my customer base goes down? With hourly employees or employees where I'm in a business where I just have to have people at work and you can't work remotely. And obviously there are different ways you can reduce types of exposure. Your meetings are going to be held, and you're not going to be having group meetings, but this is just going to be a very individualized scheduling issue. Of course, so you got to get creative.
So, it's come in through the grapevine that WHO has declared a pandemic. for coronavirus, and now there's some questions about the impact of that on our presentation. So this is a great example of these updates that are coming in.
Now, did I tell you things were going to change and be prepared for the unexpected? So once it crosses into a worldwide pandemic, all that means is that everything that was speculative before that said pre-pandemic planning changes into, yes, we have one worldwide, but that doesn't mean that we have, it may affect some insurance policies, it may affect some reimbursables, it may affect other contract issues where there are exceptions now that there is a pandemic. But I don't think it's going to change any of the advice that we've given today, because how you respond to the outbreaks and to the issues and to the prevalence and to the employee who shows up today or tomorrow is the same as what we've been discussing. Unless I missed something, Lisa, in all your research.
Yeah, I think the one question that we might see more is about taking temperatures. And that's probably because a lot of people have seen the EEOC guidance from 2009, which does say, after a pandemic, here's what's permitted. Generally the EEOC's position is that taking temperatures is a medical examination, which there's a lot of restrictions on under the ADA. Of course, it does still depend on the nature of your business and, the potential exposure and all those circumstances, and of course, whether or not you're doing something like that the same way to everyone, right? So I think that, there might be situations where that's appropriate now that the pandemic has been raised, but it's going to be a case-by-case basis.
So I was going to recommend that you have the right to do it anyway and take the risk prior, but now I don't need to give you that risk because there is a declared pandemic and the EEOC's guidance applies.
Right.
What do we have next?
I think the Road Warrior 2 might be a great one to do.
Okay.
At this point.
Let's go back to our next hypothetical on the Road Warrior Part 2. So, Fred's Widget Company is taking a different approach and decides to make business travel an option for their sales force in areas where there have been COVID-19 outbreaks. They want each employee to sign an assumption of risk statement. So the question, is that enforceable? Can I require employees to waive their rights? And the answer is, depends on state law, but probably no. Employers generally can't require employees to waive in advance their rights under workers' compensation schemes, so I can ask them to do it, but if they get sick while on business travel as a result of this, then the answer is they might have a claim.
So, returning to, we've had a few questions related to HIPAA as far as preserving the confidentiality when it comes to asking employees about symptoms or any information, any questionnaires related to COVID. Do we have any recommendations or concerns about HIPAA in that regard?
Okay. 90% of the time what people think are HIPAA questions are not, because they're not involved in the administration of a health insurance plan. But even if the ADA doesn't apply to the conditions, you should treat all of these inquiries as confidential medical inquiries. You should keep them segregated in separate files. All that advice on ADA confidentiality of medical inquiries, just like you would with reasonable accommodations, and limit the access to those with a need to know.
Another common question we've received is when an employer is required to notify a public health agency about a possible exposure or even a known exposure, I guess depending on whether the employee reported to work that day or not.
And I don't think that there is an answer to that other than that's going to vary by state and local officials. And what you are told today in your locality would probably be any suspected contact or exposure should be reported immediately so they can come out and check it and verify and determine whether there's tracing or containment or anything else. So if there's anything that suggests that this is COVID and any markers rather than just the cold or maybe a mild flu, then, or if in doubt, call. At some point they may decide to give different advice to not be overwhelmed, but today, call.
Right, and they will also provide guidance about quarantining and isolation. I know that's a big concern on everyone's minds. And short of separating someone who clearly becomes visibly ill and confirms either that there's potential exposure or confirmed exposure, which you definitely should do, the local health, public health agency will tell you, do you need to close down a certain part of the building? Should you tell employees not to come in the following day? That's what they're there for, and they should be one of your first phone calls that you make to make sure you're following the proper standards. You want to continue with our
questions?
With our hypos?
Okay. Well, let's do the next one. So county officials want to require every employee to self-report all cold and flu symptoms. This is for their own employees, and then answer questions. Several of the unions ask whether this violates the ADA. Are these lawful questions? Answer, yes. Under EEOC guidance, you can ask these employees if they're experiencing these types of symptoms, and it has to be kept as a confidential medical record. We have now reached 1 o'clock. I am going to read the closing for those of you who need to sign off immediately. We will stick around for a little bit for other questions and maybe a couple more of our hypos. For those who need to leave, this concludes our webinar for today. Please watch for the survey over the next 3 business days, which is where you will report back the CLE codes to receive credit. We will also follow up with anyone who submitted a question that we weren't able to answer during the webinar. We may blend questions together rather than every single one, given the number. But thank you for joining us, and have a terrific day for those who are leaving. And for those able to stay on for a few more minutes, we'll continue. So any other general questions?
Yeah, I think one that we've been getting a lot is size of meetings. What's appropriate at this point? Should all large meetings be canceled across the board? All non-essential travel, things of that nature. What are your thoughts?
Okay, so this is going to be one of the most frequent should we rather than must we questions. And whenever I mentioned that should questions are business judgment questions. So I'm going to tell you the factors that you are weighing here. I am getting these every day. I got them from my pastor about whether my church should close services and others about canceling nonprofit fundraising events. So here's the issues. For the vast majority of people who are going to get this illness, they are going to have mild to no symptoms. My kids are not, my 20-somethings are not going to have more than a cold or a light flu, or may have no symptoms whatsoever. We have a high-risk population. If I close down meetings, everybody who closes down a meeting provides some small, little additional protection to prevent possible community spread. But if you're going, and everybody contributes, but until there is widespread containment or quarantine, it's only going to make a small difference again in overall community spread. So the advice so far has been, the limited advice from CDC was that those in vulnerable populations should avoid enclosed spaces with little ventilation and where there's going to be very close proximity. So depending on the nature of the event, where it's being held, there are things you can do to run events, and some of those were in the earlier slides, that will reduce risks, or you decide to hold the event and make it easy for those in vulnerable populations to participate remotely or isolate them or do something else. Or you can decide as a judgment to just contribute to social distancing, that maybe you will just cancel and reschedule for a later date. But some companies have got live events that they just can't move online, and this is how their business is run. So these are going to be case-by-case business decisions right now, until and unless your local public health officials direct otherwise.
I think at this point, what will be most helpful is recirculating those FAQs and joint responses that we mentioned. We are available. Let me get to our contact information here. You can reach out to Rob, me, or both of us, or any other contact you may have here at Saul Ewing for any follow-up questions, and we will definitely return your inquiries. And we will be publishing the PowerPoint, the preparedness plan questionnaire, and summarizing our responses to the questions that we've received after this presentation.
Thank you all very much.
Thank you, everyone.